Well, good evening everybody and thank you for joining us. My name's Claire Turnbull, I'm the Equine Veterinary Advisor at Bowring at Ingleham, and on behalf of the company I'm delighted to welcome you to the Laminitis Revolution 2. This sequel has been produced as a result of the huge popularity of our first Laminitis Revolution programme, which was shown in April but is still available on demand on the site. We wanted tonight to be bigger and even better than the last presentation, and so we've got quite a lot to fit in. We've expanded the panel to contain 3 experts in their fields. It's not often we get people like this all together in the same room, so I hope you're all going to enjoy it. We have David Rendell from the Liphook Equine Hospital, who you may recognise from the first programme, Dr Joe Ireland from the Animal Health Trust, and Dr Teresa Hollands from the University of Nottingham. So tonight promises to be an incredibly informative programme, and we hope that it will really help anybody out there who's ever had a horse with laminitis or is just interested in the subject. We've got plenty of video footage to supplement the presentations, and we really must thank the staff at Red Wings Horse Sanctuary in Norfolk for allowing Teresa, Joe and myself to invade the centre for a day's filming and for being so supportive of the Talk About Laminitis campaign. And actually we have a message now from Nikki Jarvis, who is Head of Veterinary Services at Red Wings.
Hello and welcome to Red Wings Horse Sanctuary, where we're incredibly pleased to be supporting the Bowring at Ingleham webinar today. Red Wings is home to over 1,300 horses, ponies, donkeys and mules, and I'm sure the public are aware many of them come to us in very poor states of health and very, very underweight. Equally, it's as big a welfare issue if a horse is overweight, because it can contribute to laminitis. One of the factors that plays a part in laminitis here at Red Wings is PPID in the older horse. We prefer to diagnose PPID by using clinical blood testing. However, there are a great many clinical signs that owners may spot in their own horses that alerts them to this disease. And obviously Joe Ireland will cover aspects of that today. And Teresa will be looking at fat scoring horses. So again, owners can assess their own animals. If you'd like any more information about anything you see today, then please visit our website, and there's more details on all of the diseases we'll mention. Enjoy the webinar.
So we must move on with the first presentation, but before we do, if you have a question that you want to ask one of the experts tonight, there is an Ask a Question button on your screen, so you can ask questions and at the end we'll try and get through as many as possible. So David, we're coming to you first. Can you give us a quick recap of the story so far that you went through in the first Laminitis Revolution presentation, please?
Okay, that's a challenge in a few minutes, but we'll see what we can do. So I think firstly we need to stress that laminitis is a really painful condition. This is Ross Eager, who you saw in the last programme, just musing over how best to tackle this mare that's got laminitis, and you can see the amount of discomfort she's in and the amount of mental anguish he's going through and trying to sort it out. So just as a recap over what laminitis is, and apologies for those of you that can remember all this from last time, but itis literally just means inflammation. And when the laminae become inflamed, i.e. laminitis, they not only become painful, but they also start to swell and they separate. And there's a whole load of changes that take place within the laminae that end up causing them to pull apart. And you can see from the diagrams there on the left, firstly, you've got the normal situation, just in that schematic diagram with the blue arrow there. The 2 layers of laminae, one attached to the bone and one attached to the hoof, are nicely together and they stick together like Velcro. When they become diseased, their normal function disappears and they start to separate, as you can see in the red arrow. So there's nothing to hold the bone there, the pedal bone, where it should be against the hoof wall, and it starts to move away under the forces of gravity and the horse's weight and starts to push down towards the bottom of the foot. So just in case you don't believe me, there's some x-rays here or some radiographs from a normal horse on the left, and we tend to highlight the dorsal hoof wall, the wall at the front of the foot, with something that shows up on x-ray. So that's that white line on the left. And you can see that white line is nicely parallel to the top of the bone. As you go down through the foot, they're an equal distance apart. Whereas in the foot on the right, we've used a different marker on the right, but you can still see the outline of a white line down the front of the hoof, and you can see there's a massive and a very increasing distance between that marker and between the bone within the foot, and that's shown by that arrow, and that arrow is showing the movement of the bone away from the front of the foot. And you've got two tissues there that are literally being pulled apart. So you can imagine how painful that is, just like tugging on your fingernail. And furthermore, in that x-ray there, the bone is actually pushing down through the bottom of the foot onto the ground beneath it. So that bone is going to run into a whole load of problems as well. So that's excruciatingly painful. Regrettably, that horse would have been put to sleep, and for anyone that's watching their tea, they might want to look away for 2 seconds now. We've got a slide of an actual foot from a horse that has been put to sleep. So apologies, it's a bit graphic, but I think it's important we understand the magnitude of what's going on. So this is a section through a foot, showing a very similar situation to what was going on in that x-ray on the right. So you can see the arrow points to the tip of the bone where it now is, not where it's supposed to be, but it's now pushing down through the bottom of the bottom of the foot, and you can probably see that the tip of the bone is starting to essentially go rotten. And the star there just shows the separation of the two layers of laminin. You've literally got an air-filled gap between those two structures that should be tightly held together. So you can imagine how painful that is, and unfortunately once horses get into that situation, it's just not humane to continue in the majority of cases. So we unfortunately end up in the situation we were with this case. So what's causing laminitis? There's been a lot of evolution and changes in our understanding. The two main theories at the top, the numbering's gone a bit askew, but pretend that's 1, 2, 3, 4. The grass can potentially cause changes in the bacteria in the large intestine. Or the second cause, the grass can potentially cause sugars to be absorbed from the small intestine, and that causes spikes in insulin. And then those two causes probably, or traditionally have been thought to explain the grass-associated laminitis that we tend to see in the vast majority of cases. And then we get different kinds of laminitis, which are probably different diseases. Laminitis is just a common end stage to lots of diseases. So we've got septic laminitis, horses that have infections, and very rare cases those are, and then all equally rare cases of those that have just done too much hard work. Like few and far between. The overwhelming majority of these cases that are associated with horses and ponies that are turned out or eating too much. And so those are the main two theories for those two cases. Changes in bacteria in the large intestine causing toxin production, or increased sugar absorption and increased insulin levels. So we've seen a bit of a shift in our understanding recently. But we're still focused on those two potential causes. And I just want to stress the point that grass and overeating remains central. I'm not suggesting alternative theories for laminitis, but I'm just trying to explain why the grass and why the overeating can lead to the laminitis. And our understanding has evolved around those two theories. And we've seen a bit of a shift from the large colon theory with the bacteria changes to the sugar absorption and the high insulin theory recently. So if we just look at that in a bit more detail, I've concocted a traffic light system on a homemade fructometer just to try and easily summarise some of the evidence that's been and some of the studies that have been done in this area. So different experiments have been done looking at these different theories, and people have tried to overload the colon with sugar to see what happens, and they've given them sugars to see what happens to insulin levels. And the amount of sugar you need to cause colon overload is a lot higher than it is to cause insulin overload. And if you compare that to what a 300 kilo pony is eating, like there's lots of numbers there that for those that need a little bit of extra maths homework tonight, but the arrows on the right are the things to focus on. Now if a pony, the blue arrows, if a pony ate its entire grazing, the entire quantity it's going to eat in a day, if it ate it all in one go, it could hit that top arrow and get 3 kilos of sugar in one go. Now that means it's literally just like that got to eat its daily grazing amount. So it's not going to do that. If we pull it down and say, well, a pony, if it was really pushed, and we know that they can do this, if it's really pushed, it can eat everything it would normally eat in a day in 3 hours. It's still not getting to the level that you would require to cause overload of the large intestine, but it is at the level that it can cause high amounts of insulin and potentially laminitis. And realistically, if we consider a pony is grazing constantly through the day, we split what it eats into 24 hours, it's that blue bottom arrow. So it's quite a low level on our fructometer there, but it's in the orange level, so the insulin overload level. So it's far more likely that we're going to get problems with insulin overload than we are with changes in bacteria as a result of changes in the large intestine. But there's more work to do on this, but the insulin theory is the predominant theory at the moment, and there's plenty more evidence that supports it. This was a very nice study by a researcher at Cape Bora at the Royal Veterinary College in London, just looking at insulin and laminitis and showing the differences between those horses and ponies, or ponies that don't have laminitis and those that do have laminitis. So the normals are shown there on the graph, and the laminitics are also on the same graph just over to the right. Now, at rest, so just a normal blood sample before there's any kind of feeding challenge, the insulin levels are shown by the blue bars. So they're pretty low, slightly higher in the laminitic individuals anyway. As soon as we give these animals some sugars, the insulin levels in the normals go up, that's the red bar, but in the laminitics they fly up far more than they do in the normal animals. So we know that ponies with laminitis are far more likely to have big spikes in insulin. So again, sort of adds weight to the theory that insulin is critical in the development of laminitis. I haven't got time to go through all the data we went through last time, but we also know that if we give large amounts of insulin, we will cause laminitis. Just change the insulin level on its own, keep everything else the same, you will cause laminitis. And there are mechanisms by which we can explain this. Insulin has 101, or far more than that, different functions within the body. It's not just regulating sugar. It's a really important molecule for a lot of different processes. One of the things that it does with relation to laminitis is affect the blood supply to the foot. So clearly that could be influential in foot damage developing. It also controls cell division within the foot. And again, obviously, it's important that the cells divide at just the right controlled rate for the lamina to function normally. So if that function gets disturbed, then that again could be a link with laminitis. And there's a lot of research going on into these and many other different theories at the moment. But what we do know is equine metabolic syndrome, EMS, and PPID, or Cushing's disease, both cause high insulin levels, and both of these conditions are very strongly linked with laminitis. So, just by way of a recap, and we're going to go into this a lot more through the rest of the evening, equine metabolic syndrome is a syndrome very much like human metabolic syndrome. That's where the term's been taken from. It's a syndrome of insulin overload. Horses and ponies that have high insulin levels, the same animals that have they tend to be fat. Now that can be physical obesity, so you can see that they're fat, or it can be functional obesity. They don't obviously look outwardly fat, but they've got fat deposits there that are producing lots of different chemicals from their fat tissue called adipokines. Now we all think of fat just being a storage organ that doesn't do anything else, which is very much not the case. Fat is a really important organ. It produces a lot of very active molecules, and some of those will change the metabolism. So having too much fat tissue and high insulin levels can increase the risk of laminitis, and this is central to equine metabolic syndrome. And you may see it. You may see outward signs of laminitis, or there may just be hidden signs, and the pony may just have those chronic, ongoing changes in the feet, which may be causing it some discomfort that you may not notice. And that's what we talk about with subclinical laminitis. So it's not yet clinical, but the problem is there. Other features of horses and ponies with equine metabolic syndrome that we're slightly less concerned about compared to laminitis, but still are important. They have high circulating fat levels in their blood. They can have high blood pressure. They can have increased inflammatory markers in their blood, which isn't necessarily healthy. And some mares can have abnormal reproductive cycling. So those are the key features of equine metabolic syndrome, which we'll talk a lot more about. Pituitary pars intermedia dysfunction is the correct term for Cushing's disease, as we used to call it. We should start calling it pituitary pars intermedia dysfunction, or PPID. And that's an aging-related change in the nerve fibres within the brain that causes an increased production of hormones from the pars intermedia in the pituitary gland. And that can cause a whole number of clinical changes, including upsetting insulin levels and upsetting other hormone levels as well. And Dr. Joanna's going to talk a lot more about that shortly. So that's just to show you there that the hypothalamus up at in the brain sends these nerve fibres down to the pituitary gland, and it's those nerve fibres that become damaged and change the hormone levels. So are these conditions important? Well, I think it's important to summarise a couple of studies that just demonstrate how important they actually are. Now, these are two studies, one from America and one from Finland, showing 40 cases and 36 cases respectively, and just showing you how important PPID and EMS are as a proportion of the number of cases of laminitis that they looked at. In the American study, 70% of the laminitis cases they saw out on the road through a veterinary hospital had PPID, and over 20% had equine metabolic syndrome, and only 7% couldn't be explained by one of these conditions. And then in the study from Finland, again, slightly twisted around the other way, but the overwhelming majority were either PPID or EMS, as you can see from the pie chart. And some of those in the white bars that weren't either of these conditions weren't actually tested. But you can see there from those two studies, combining them, about 90% of laminitis cases were attributed to a hormonal disorder, EMS or PPID. And you could rightly say, well, that's America, that's Finland, might be different from the UK. Well, yes, it might. This is a study we did at Lippock Equine Hospital. We looked at 118 horses that had gold standard tests done for PPID and equine metabolic syndrome. We're currently chugging through 12,000 cases, which will give us a far more valuable set of information, but takes a minute or two to get through the data. But the end result is exactly the same. The trend is exactly the same. 80% of them had an endocrine disease, with the vast majority having high insulin levels. So I hope that gives you a nice introduction into how insulin and these hormonal diseases are central to the cause of laminitis.
Well, thanks for that, Dave. I think you did a sterling job there of summarising quite a complicated area in quite a short space of time. Yes. And I think what you're saying really exhibits a big change in the way that vets are now approaching how they manage their laminitis cases.
Yeah, absolutely, hugely. Over the last few years, there has been a real quantum shift in the way we do look at them. Rather than just treating the laminitis as we see it, we're actually looking for what's causing that laminitis and trying to make sure it doesn't happen again. So yeah, there's been a massive quantum shift.
Perfect. And you're going to cover laboratory diagnosis and treatment later on in the programme. Okay. So perfect. When we filmed the first programme in the spring, in the April, we were surrounded by spring grass-filled fat, overweight ponies. But at this time of year, in the autumn, although EMS is still a concern, we do tend to see more cases of PPID clinically. And in fact, looking at the latest Talk About Laminitis free testing results, we've seen a 50% increase in PPID patients diagnosed at this time of year. And I think that expert vet surgeon Dr. Jo Ireland, with her special interest in epidemiology, is probably best placed to talk to us about that in more detail. So Jo, over to you.
Thank you, Claire. I'll try my best. So, as David's already pointed out, we know from recent research studies that around 90% of our laminitis cases are going to have an underlying endocrine disorder. And really, that's going to be one of our two main endocrine disorders in horses and ponies. So PPID, which is common in mature and veteran horses and ponies, and is often associated with chronic or recurrent episodes of laminitis. Or equine metabolic syndrome, which is a more complex endocrine disorder comprising high insulin levels or insulin resistance, obesity or at least abnormal fat deposits, and laminitis or a predisposition to laminitis. Some of the less common causes of laminitis, again, that David mentioned, are illnesses that would have a severe inflammatory response, so that result in the equivalent of sepsis in human medicine, things like severe colic or diarrhea cases, very severe grain overloads, or perhaps a retained placenta after foaling. And sometimes we can see severe laminitis in the opposite limb, where we have a severe injury resulting in a period of that opposing limb having to take extra weight while the injured limb is recovering. But as vets, we're very aware of the high risk of laminitis in these sorts of cases, so they're relatively uncommon, and we're in a position to try to prevent these cases of laminitis. So really what we're focusing on tonight is the link between laminitis and PPID. David's again mentioned that PPID is so termed because it's caused by a dysfunction of the middle part, the pars intermedia of the pituitary gland, which is a small gland located at the base of the horse's brain. And despite its small size, it's a very important gland as it controls a lot of the body's hormone systems. In PPID, we get degeneration of the nerves which serve the pituitary gland. And therefore, once we have that degeneration in the nerves, we have reduced production of a chemical called dopamine, which is important in controlling the hormone secretions from the pituitary gland. This reduced level of dopamine then leads to a loss of inhibition on the middle part of the pituitary gland, and that results in the excessive secretion of a range of different hormones. And it's these excess levels of hormones that will cause the range of clinical signs that we see in affected horses and ponies. So how common is PPID? Well, research studies have shown that at least 1 in every 5 veteran horses and ponies will be affected, and it becomes more common with increasing horse age. So after the age of 15 years, the risk of developing PPID will increase by about 18% each year. Currently, the average age at diagnosis is around 19 to 20 years, but as owners and vets are getting better at early disease detection, we are increasingly diagnosing it in younger animals. Looking at data from last year's Talk About Laminitis campaign, we can see that, again, very much like the research studies have shown, the prevalence of PPID increases. So it's highest in our older age groups, heading up to about 3/4 of the animals aged 30 years or over being affected. I think it's also really important when we look at this lower age range in our sort of adult and mature horses that we're still seeing a relatively substantial proportion of those animals that are testing positive for PPID. Historically, it was thought that perhaps mares might be at increased risk of developing PPID, but certainly our recent findings have suggested there's no difference in risk between mares, geldings or stallions. And again, some of the early case series appeared to indicate that it was a disease that more commonly affected ponies. Our recent research studies have shown that that's not the case. There's no difference in risk between horses and ponies, or in fact between different breeds. And I suspect that the tendency towards seeing PPID more commonly in ponies might just reflect the fact that ponies tend to live longer compared to horse breeds. And also, as we'll come on to see later, some of our clinical signs of PPID are perhaps more obvious and certainly more frequently observed in our pony breeds. Now, in both normal horses and ponies and those affected by PPID, we'll see an increase in hormone levels during the autumn months. And that leads in turn to an increase in the proportion of animals displaying clinical signs of PPID and in turn being diagnosed with the disease during the autumn months. Interestingly, although we said overall that there was no difference in risk between horses and ponies, during the autumn in last year's Talk About Laminitis data, we found that both donkeys and ponies, a significantly greater proportion of them, were testing PPID positive during this time of year. And we wonder if perhaps that's something to do with the seasonal changes in their hormone levels, or perhaps the sort of clinical signs that those particular types of animals are showing. And when we compare that during the spring and summer months, the difference then in the proportions of PPID positive horses and ponies becomes much lower, and we'll see that there's no difference between the proportion of positive animals between horse and pony breeds. So we have to remember that because PPID is an age-related degenerative condition, it's often going to have a gradual onset of clinical signs, and that each individual case will have a variation in terms of the clinical signs that they're going to show. Early or mild cases might be very difficult to distinguish from some of the signs that we associate with normal ageing. And we know that owners start recognising changes associated with ageing around the 20-year-old mark in their horses. And those will include stiff joints or lack of joint flexibility, weight loss and muscle loss, as well as things like increasing grey hairs and hair coat changes. Now, when we're looking at the clinical signs of PPID, this is a very long list and it's not exhaustive, but these are some of the more common signs that we might see. It's important to remember that not every case is going to develop this full range of clinical signs. And in fact, it's very unusual for horses to have this large number of clinical signs. They would tend to be older animals with much more advanced disease. Last year's Talk About Laminitis data showed that 85% of PPID positive animals had 2 or less clinical signs reported at the time of their diagnosis. So it's important to remember that we're not necessarily going to see this whole spectrum of signs in affected animals. Looking at our clinical signs of PPID compared to those signs of ageing, you can see why I highlighted that it might be difficult to distinguish between the two. When we look at our average age of diagnosis for PPID, it's really the same age at which owners start noticing signs of ageing. And things like the hair coat changes, the loss of muscle and weight loss, and perhaps increased susceptibility to infections or a reduced immune function are common to both. And it may actually be that we're thinking these are signs of normal aging, when in fact they could be early signs of PPID. Looking at the hair coat abnormalities in a little bit more detail, this can range from the classic image of the PPID horse or pony with the very long, thick, curly hair coat year round. But what I think we see much more commonly are these subtle hair coat changes, where you can see the picture of the horse in the bottom, where we have just a failure to shed their winter coat normally. Up to 30% of veteran horses and ponies are going to exhibit these sorts of coat changes, and in fact 70% of animals with only hair coat changes tested positive for PPID. Interestingly, this is one clinical sign that's identified much more commonly in our pony breeds compared to horses. Obviously, we're talking tonight in a lot more detail about laminitis. And again, as David showed earlier, PPID is diagnosed in anywhere up to about 70% of horses and ponies that are presenting for laminitis. From the Talk About Laminitis campaign last year, 60% of animals who only had laminitis as a clinical sign tested positive for PPID. And in fact, these animals, whether they have a current episode of laminitis or whether they just have a history of laminitis in the past, are 5 times more likely to have PPID. And while this laminitis can occur at any point year-round, there's certainly a significantly increased risk of laminitic episodes during the autumn months. And interestingly, again, we've got this difference between horses and ponies. So pony breeds are more likely to have hoof abnormalities that are consistent with having chronic laminitis, such as convex soles or the classic laminitic growth rings. And these horses and ponies are often younger, so it may be that laminitis is a sign of PPID that we might see in younger animals, and in many cases it might be the only clinical sign of PPID. Looking again at the Talk About Laminitis data, we can see these are now the cases that presented with only laminitis, so no other clinical signs of PPID. And again, obviously our prevalence increases with increasing horse age. But it's important to realise that, again, look at our younger animals, so those between 10 and 20 years, compared to the overall figures, the percentage of these animals testing positive where they have laminitis as a clinical sign is about twice the proportion that tested positive overall. Some of our other signs of PPID might include lethargy, or perhaps in animals that are still in work, it might just be noticed as a reduced ability to exercise. Often this is diagnosed retrospectively, so we tend to think that they're getting slower and quieter with increasing age, and often once they're successfully treated for PPID, owners realise that perhaps actually they were slightly lethargic beforehand. We can see excessive sweating. Obviously, in some of the cases, that might be associated with the long, thick hair coat, but it isn't always. We can see excessive sweating in animals with a normal hair coat. And in a much lower proportion of cases, we can see increased thirst and urination, and perhaps an increased susceptibility to some of the sort of more common infections, such as skin infections, sinusitis, and some of the dental infections, such as gum disease that we might see. Obviously, one of the classic signs, again, of PPID is often quoted to be the development of these bulging fat pads above their eyes. But actually, this is relatively uncommon, and a relatively few horses and ponies with PPID will present this as a clinical sign. But what we often see is a dramatic change in terms of their body shape. So they will lose muscle, particularly across their top line, and some of them will lose weight as well. But they'll often redistribute their fat. So while they might not all develop these fat pads above their eyes, they may develop fat pads elsewhere, and they can develop a pot-bellied appearance. This can make assessing their body condition very difficult, and Teresa's going to discuss in much more detail later on how we might conduct fat scoring on these horses and ponies. But obviously it's very difficult to appreciate a lot of these clinical signs and still photographs. So we now have a video of some of the horses and ponies at Red Wings who are showing some of the clinical signs of PPID. This is Mac, and he's 26. He's looking relatively healthy, but some viewers might notice that he's starting to show signs of his age. So he's got deepening of the hollows above his eyes. He's starting to get some grey hairs up around his head. But what I'm going to demonstrate is just that the signs of PPID can easily be mistaken for normal signs of ageing. And it's certainly not the case that all animals with PPID will exhibit the full range of clinical signs that we've discussed. So we just use Mac to demonstrate that while owners of older horses and ponies frequently report that their animals will lose muscle tone or perhaps even lose muscle as we get older, in Mac, because of his PPID, this muscle loss is much more pronounced, so particularly along his neck, along his back and over his hindquarters. He's also developing quite an obvious pot-bellied appearance. And some viewers might notice that he has some subtle hair coat changes. So his coat is slightly thicker and slightly longer than we would expect for a summer coat. But we'll demonstrate the clinical signs of the coat changes on another pony. A long curly hair coat that doesn't shed normally in the summer is one of the classic clinical signs of PPID, but actually that's relatively unusual in less in advanced cases, and what we'll tend to see much more commonly is more subtle hair coat abnormalities. This is Bertie and he's 22, and you can see that compared to Mac, he does certainly have more obvious hair coat abnormalities. So his summer coat has these long, dull, coarse hairs within it. He's got a very thick coat, given that it's supposed to be his summer coat. He's also showing a sign of patchy sweating. Now, this may be to do with his excessively long, thick hair coat, but we will see patchy sweating in cases of PPID, even with normal hair coat. He also has signs on his feet of these very prominent growth rings, which may be suggestive of previous episodes of laminitis. So we've already looked at Bertie, who's 22, with his abnormal hair coat. But just to demonstrate that these sort of coat changes aren't just associated with normal ageing and do in fact represent a clinical sign of PPID, we've also got Steele, who's the same age as Bertie and has a completely normal, smooth summer coat for this time of year. As part of the fat redistribution we sometimes see in cases of PPID, people will talk about horses having obvious bulging fat pads above their eyes. But what we often see more commonly is that they'll develop extra fat laid down under their lower eyelid, giving them a puffy appearance to the lower eyelid.
It's a hard life, isn't it? Spending all day cuddling cute ponies at Red Wings.
It is indeed. The staff and the horses and ponies at Red Wings were fantastic, but we did do some hard work too.
We did. And Teresa, you were there with us as well. You've produced a film showing people how to fat score their horses and ponies, which we'll see later. I do hope you will not be fat scoring the presenters.
No, don't worry, Claire. I think horses are much more interesting to do.
Very good. That's good to know. Okay, so Joe's now told us how we can suspect and identify horses that may be Cushing's candidates at home. But once we've had that suspicion, the next step is to contact your veterinary surgeon and talk about maybe doing some testing. So that's where I come to you, Dave, because I believe your practice tests huge numbers of horses for Cushing's every year, have samples coming in from all around the country. So are you going to talk to us a little bit about diagnosis?
Yep, sure.
Perfect.
All right, thanks, Claire. Yeah, we do test rather a large number every year. And fortunately, PPID, Cushing's disease, is one of those conditions where we can actually test for it with a blood test. We're always being asked as vets whether we can just do a blood test, and this is one condition where we actually can. The thing we tend to test for is ACTH, or adrenocorticotropic hormone, which is one of the many hormones that is released from the pituitary gland normally, and then when the horse gets dysfunction of that gland, these hormones are produced in massively increased quantities. And there's a list there of those that are produced from the pituitary gland, and then in brackets, those things that are secondarily increased increased as a consequence. So ACTH is the main test that we have available to us. It's an extremely reliable test, and at the moment, as part of the Boehringer Talk About Laminitis scheme, the lab testing itself is free until the end of November. So it's worth considering that, and especially worth considering that as you can see from the graph there, through this time of year, from August to November, the concentration in the blood of hormones from the pituitary gland goes up considerably. So that actually makes this autumn time a more reliable and better time to test for Cushing's disease, because there is that big difference between normal horses and horses with PPID. Obviously, hormone levels are always fluctuating a little bit, but at this time of year, there's a big disparity between normal and PPID, so it's a good time to test. So, in addition to PPID, we need to think about EMS. I know we've said that PPID is better to diagnose in the autumn, and it seems to account for more laminitis cases in the autumn, but we mustn't forget EMS because that might still be the cause. And again, we can test for this relatively easily with a single blood test for insulin on this occasion. It requires a period of fasting, so generally we say take food away overnight, and then we come and check insulin levels in the morning. And we can either do that at rest, so we just take the insulin level, or we can do it after we give them some kind of sugary challenge, because as we showed in the graph earlier on, those horses and ponies that are prone to laminitis will have a very exaggerated response to sugars, and we can use that to our advantage to make this test more helpful and more reliable. So you can either give the glucose in feed, some vets will give it intravenously, but you can discuss with your vets the options for testing for EMS, but whichever way you go about doing it is extremely straightforward. So you might say, well, we've just talked about clinical signs for PPID, and we're going to talk a bit more about EMS. If the clinical signs are obvious, well, why do we need to do a blood test? Well, as Joe's explained already, the clinical signs aren't always totally reliable. You can miss early disease, so the blood test therefore is a great advantage. And it's very helpful to know what ACTH and insulin levels are doing in cases with EMS. We need to rule out PPID, so we need to check ACTH levels. And with PPID, it's useful to have the insulin as well to assess the risk of laminitis and see what other metabolic problems there might be. So it's good practice to test for both of them, and they're relatively inexpensive, even when there aren't the subsidised schemes to cover the cost of ACTH testing. The treatment of EMS and PPID are very different, so we need to get it right. We need to know what we're dealing with. And it's important to mention that you may unfortunately be in denial about the condition that your pony has. So 50% of horses in the UK are overweight. There's been a couple of studies that have suggested that, but the number of owners that think their horses are overweight is down nearer 20%. So there's an awful lot of people that don't think their horses are overweight, but yet they are probably suffering from EMS, and they are likely to be at increased risk of laminitis. And that is why laminitis continues to be such a massive issue. And similarly with PPID, as Joe's already said, the signs come on very slowly, and if you're dealing with a horse every day, twice a day, more often, it's very hard to pick up on those changes, and things creep up on you. So if there's any doubt, a blood test can be extremely helpful. And a lot of cases of PPID do unfortunately go undiagnosed, and horses continue to get laminitis, which potentially could have been avoidable with treatment. So all those things aside, it's also useful to have laboratory information to assess the severity of disease, so we know how bad it is and where we're starting from with treatment. And if we know where we're starting from, we can also assess the response to treatment, not only in terms of the clinical signs, but we can actually look at the laboratory data and see how well the hormone levels are coming down, which gives us a more reliable indication of how we're progressing with treatment. So in short, and I'm not going to steal Teresa's thunder because she's going to talk about this in far more detail later, but treating equine metabolic syndrome is essentially just controlling diet to prevent that insulin overload that we talked about earlier. We need to just keep those insulin levels down and reduce the risk of there being any secondary problems as a result. And that is essentially weight loss, or if the pony appears to be in reasonable condition but still has these very active fat deposits, it might just be a weight management plan to try and get rid of those focal deposits and prevent any further obesity. And some people do use drug treatments, and I'm not saying they don't have their place, but they are absolutely no substitute for diet and appropriate management. If you do just rely on drugs, you will not get anywhere. So drugs rarely have a place, in my view. This is a condition that needs to be managed very carefully, predominantly with diet. But Teresa's going to talk about that later. With pituitary pons intermedia dysfunction, we can do a lot of things to improve matters with management, but we can't do anything about the disease itself without a drug treatment. And there is only one licensed treatment that's proven to work, and that's pergolide. And yes, it's a drug, and yes, it costs money, but if you cost out a year's treatment for pergolide, and you also cost out what it costs to properly deal with a bout of laminitis, you'll actually find that it's far better to be proactive and prevent the laminitis occurring. And that's purely in financial terms, irrespective of the enormous welfare implications of recurrent laminitis and the stress to you and to your horse and the time off work and so on and so forth. So there is a very strong argument for treatment. Pergolide simply compensates for the nerve damage, so the nerves should normally release dopamine to inhibit the production of all these hormones, and pergolide just provides you with a source of dopamine that just does exactly the same job as the nerve. So as the diagram there shows, it takes it back from being a pituitary gland that's pumping out lots of these little molecules that are shown there in red and orange, takes it back to a more normal situation, so it suppresses the abnormal secretion of these hormones. And we see an excellent response. We've done a number of studies, which I haven't got time to go through tonight, but a number of studies showing how horses' hormone levels come down as a result of pergolide, and it also improves the clinical signs. And so in the vast majority of cases, it's an extremely, extremely successful treatment. It's also important to think about ongoing monitoring with blood tests for horses with PPID, just to make sure that we've got things under control. We can often see an improvement in clinical signs, but the pituitary can still be hyperfunctioning, and that can still leave the horse or pony at risk if other factors change. And we're also inclined to be optimistic about how our horses and ponies get on. Obviously, there's often a placebo effect with most drugs, so we can be tempted to think they're better, but we ought to really check their hormone levels to make sure they truly are better, and make sure that they're not at increased risk, especially running into the autumn. So we would suggest that horses are tested reasonably frequently until we get their levels down. Now, it might be you just get their levels down the first time, and that's great, but you might need to do a couple of tests to make sure that their hormone levels are okay once they go on treatment. And then once things are under control, ideally a couple of tests a year, including the autumn when things change, but then potentially you can reduce that down as you kind of get to know what dose your horse or pony needs. And it's also very helpful to check insulin levels, especially in those horses that we're struggling a little bit to control. That can give us really useful information as well. Dietary management for PPID is also really important. It can't do anything about the disease itself, but all these things feed into reducing the risk of laminitis and improving the horse or pony's well-being. And again, Teresa's going to chat about that a bit later. And I don't want to overlook the general husbandry measures that are important if the horse is on treatment, or if it's one of those that for whatever reason isn't going on to treatment, then you've got to think about dentistry, you've got to think about farriery, clipping if the haircut is still long, which it shouldn't be on treatment, and then also being really vigilant about dealing with infections and parasites aggressively, because horses with PPID are at increased risk of these secondary issues. So to summarise, from a veterinary perspective, what I think we need to take away from tonight: laminitis causes a huge amount of needless suffering in the UK every year. It's a massive welfare concern. And as well as there being all those horses that we know have got laminitis, there are also a huge number that have subclinical disease, and these animals are still suffering in silence, being a bit footy, a bit pottery. We often become quite complacent about that situation, but we really shouldn't. Those animals are in a lot of pain. So we should look carefully for the signs of laminitis, and if we see them again, we shouldn't become complacent and accept them as normality. We should think about seeking veterinary advice and examination if appropriate, to fundamentally look for the underlying causes of the condition and then try and do something about them so that we aren't seeing recurrences of laminitis. And if that's equine metabolic syndrome, then it's a case of diet and more diet usually, as Teresa's going to discuss. And if it's PPID, then pergolide is the only proven treatment. So that's the way to go in conjunction with management measures. And also in those horses and ponies that are laminitic and do have changes in their feet, it's really important not only to work with your vet, but to work with a remedial farrier as well, to try and get things back on track if damage has occurred. We'd like to intervene before damage does occur, but if there is damage and there are changes in the foot, then it's really important to work with a farrier. And that's part of the holistic approach that we would consider to be normal at Liphook Equine Hospital, and we have farriers in most days. And we're just going to go on now to show you a case that I saw a couple of months ago that came into the hospital with laminitis, that was seen by myself and also by Richard Lovejoy, one of the farriers with whom we work at the hospital.
Well, this is Echo. She's 20 years old, and I've had her for 13 years. About 18 months ago, she had a bout of laminitis. which she recovered from very quickly. She was on box rest. And then about 6 weeks ago, my farrier came out for a routine shoeing and just happened to mention to me when he put her shoes back on and was banging in now, she was a little bit sensitive. And a couple of days later, she became a bit pottery, so we took her in the box and called out the vet, Dave. He came out and said, yes, she did have a touch of laminitis. And he also did a cushions test, which came back positive. The vet came out and removed her shoes, so she has no shoes on. So today she's here for a reassessment and for the farrier to look at her feet.
Right, Richard, this is Echo. I saw Echo out on the road a few weeks ago and diagnosed her with acute laminitis. So she's come into the hospital today to see you to try and find a better way for her forward shoeing-wise. She's improved quite a lot on the bute that she's been on and with some box rest. She's also had some endocrine issues, some Cushing's issues that we've addressed. But really it's a case of you just assessing her, if you wouldn't mind, and then just trying to find the best shoeing solution we can to take her forward.
So having had a chat with Dave about the brief history on Echo, now we're going to have a look at her move. We're going to see what she moves like both in a straight line and on circles. Circles are very often the most telling of movements, and also we're going to have a little look at her statically as well, because that'll tell us a lot about her comfort levels and also what might be appropriate farriery wise. Look for demeanour too, as well as footfall. She's trying to land slightly heel first. She's landing outside first, but she has got some growth on there which would explain a lot of that. A little bit slow on the turn, but she is barefoot. She's also slightly base wide, so yeah, I'll take all that into account. So her little legs come down and they just slightly rotate outwards, so just allow for that also. If you notice, slightly short, shuffly gait. Ears went back almost immediately, not really over keen on getting on with that. Next test I'm going to do is I'm just going to see what this little horse looks like when it's turned in very tight circles. Nice and tight, and just go around 2 or 3 or 4 times, that'd be great. What we're looking for is a nice crossover of limbs. You can see she's doing her best, but she's reluctant. And then perhaps you can go the other way. That's lovely.
So we're going to take some x-rays of Echo's feet. Okay. We've got our lead gowns on for protection. Yep. What we're going to do is pop her foot onto a wooden block so that we can take a sideways view so that we can see all of her foot and image the bones in her foot. Okay?
Yeah, that's fine.
Right, Rich, this is the right foot. This is the worst one, which I guess is the same as we saw clinically. She was more sore on the turns, wasn't she, on the right? There's a bit of rotation, isn't there? That's not quite parallel with the hoof wall.
Indeed.
Possibly a little bit of lipping there, which may fit in with the chronicity if this has been going on 18 months or so. If the coronary band's there, it doesn't appear as though there's been a large amount of drop there, so it doesn't appear the pedal bone is displaced into the foot, just rotated a bit. And I guess I'm quite pleased to see that we've got quite a lot of sole here to be able to work with and quite a lot of heel, so hopefully you can get that back and try and realign the mechanics so that we've got the wall parallel and drop the heel down just to get things back the way they should be.
It's nice to see a foot like that that's got some material to work with.
Yeah.
You know, very often you've got so little to make many changes that then becomes a struggle. So that foot looks like it's in fairly good shape.
Out of interest, Richard, I thought I'd show you this one. This was a horse that came in a couple of weeks ago that had a 6-week history of laminitis. It was a big horse and it was very overweight. So whilst there wasn't an opportunity to do any endocrine testing, unfortunately I think it was fairly apparent that it would have been a metabolic syndrome endocrine laminitis case. Yeah, you can see through the different shades of grey here through that area there. There's obviously separation there. That's just a gas shadow where the hoof wall there is completely pulled away from the pedal bone, and then the tip of the pedal bone is just dropping through the sole, and I could see that before I took the radiographs. But these were just to confirm the severity of the situation, and that's just a drawing pin there as a marker for us. But
just makes you realise how drastic it can become.
Yeah.
Terrible tragedy for the owner and the horse, that one.
Yeah. Right, Richard, let's see what you think. She was obviously quite sore on the turns, and we know there's some radiographic changes there with some rotation. So in your hands, really, as to what you think the best shoeing option is.
Sure.
Whether she justifies clogs or whether we have some other kind of support with a pad, I don't know, but see what you think.
Okay, well what we'll do is, as you say, we've seen her move and we've seen how she turns, etc. So now we're going to make a visual check and see what we've got foot-wise, see how much damage has gone on and what we might be able to do that's appropriate for that. Okay, first thing I tend to do when I'm looking at these horses, Dave, is I run my finger down over the top of the coronary band and feel if I can feel a depression That'll tell me whether the peeler bone's slightly moved, how much of a movement has gone on there. If there is much movement going on, you'll feel literally a physical trough in there. Depending on how much detachment's occurred, depends how far around that trough will occur. If you look at the outside of the foot appearance, we've got these rings, classic laminitic rings. The way to tell the difference between, in my eyes, Dave, with laminitic rings and grass rings is laminitic rings tend to be wider at the heel and they tend to bump into each other towards the toe. And that's just where the heel growth is either the same or increased and the toe is compromised somewhat. So I think we've got some classic changes there. We've also got quite a nice straight spot coming out of the coronary band and this sort of bulge at the bottom half where she's had previous attacks. That's a sign that that's gone on in the past. Looking at the bottom of this foot, there are some changes going on that tie in really well with the x-rays that we looked at a little earlier. If you look at the sole condition, it's a little flat. What we like to see a bit of concavity in there, and that's a little flat, maybe even a little bit convex, but it's a sign that that pedal bone, the bone inside, has been pushing slightly downwards and forcing that sole into a flatter state. So we need to accommodate that. The heels have grown tall and moved forwards, but we have got a huge, lovely, big, healthy frog, so we can use that very much as a weight-bearing structure to help support this little horse. The bars themselves are running around here, the continuation of the wall. You can see they're trying to grow around the actual apex of the frog. That's classic in a chronic laminitic that's had a few bouts. They tend to grow really strong bars. It's almost like a secondary hoof wall, nature trying to actually sort of reinforce itself and give itself as much support and rigidity as it can. What I'm going to do is I'm going to put some hoof testers on her. So I'm going to start just around the toe and work my way backwards. She's got a little bit of reaction there, a little bit there. You can just watch her muscle response. A lot of horses will respond anyway to you're just squeezing their foot, but if you do a repeated squeeze, they'll get fed up and reacting to just being squeezed, as it were. Then I'm going to feel over the frog as well, because sometimes when the peeler bone has moved slightly, it tends to move backwards. So in a typical horse, the tip of your bone would be situated around like so. Actually, with a lot of laminitics, David, it tends to move backwards. So you want to make sure that your frog is not too painful if you're going to use it as a means to load. Trim-wise, these heels are very stacked up. They've run forwards. If we were to take the widest part of the foot back here, the widest part of the frog, we can see how far forward these heels have moved in relation to the back of this foot. So we're going to trim this foot. We're going to call what we call a derotation trim. So we're just going to trim the heel back slightly and use this back part of the foot as a platform with which to load this foot and try and relieve some of the pressure from this front half. Whatever your farrier and your vet are used to using, they have success with, then use that. Just because I'm using this one product doesn't necessarily mean this is the only fix in the world. So I'm going to use a Steward clog. It has a number of features in it that will really play into my hands. I can use a product underneath to help load through those structures in the back half of the foot. The clog itself allows for easy multi-directional breakover, so it makes it easier for the horse to turn the corners. The curve on the top of the shoe is slightly inside the laminar bed, so that makes it a lot easier for them on the turns. There's a good radius at the toe for them to break over, so you reduce tension through the tip of P3 as they go to leave the ground. The fact the horse has grown his heels up and he's moving onto his toe, we can derotate this foot, move it back to the back half of the foot, realign those phalanges, those bones inside, and hopefully make this horse a little bit more comfortable and set him up to heel that much better. The trim and the placement certainly is no matter what product you're using, that's the most important part. But once they've had it, you do need to try and offer them support and a place to heel, and using some prosthetic is usually the best way to do that. So I want to try and avoid, Dave, this area here over the tip of the bone. Yeah. So I'm just going to trim this foot from here backwards.
How many shoes do you think it's going to take to get the foot mechanically as it should be, rather than as it is now, as we can see on the radio?
I would say about three shoes. We should be just about there. This is not a bad foot. It's not hugely out of whack. I'm not going to take a lot of these bars off, David. I'm going to leave a lot of that in there. So that's just the back half of the foot been dressed from there backwards. So we're going to be predominantly using this back part of the foot. I'm going to use underneath our clogger a little impression material. It's just a rubberized product that will go off underneath, but I'm going to put it in the back of the foot. So I'm going to use that rubberized material to fill that void, which will then make contact with the clog or whatever it is I'm going to use on top, in this case the clog, on top of that. So it'll help push from the ground through the clog and then into the back part of the foot. Okay, Dave, this impression material should have gone off by now. So we'll just take this base plate pad, just helps the impression material set off flat. Yeah. The trouble is, if you don't use that, you tend to get a bulge in it. I'm just going to put a smear of magic cushion just around this sole just to help keep it clean. This is a product that will help stop the foot getting smelly and unpleasant underneath. I've drilled 2 little pilot holes down through the foot and I'm just going to attach. Okay, and now we're going to apply the casting tape, which will help hold the clog in place and also just give the foot some rigidity. So there's not as much flex through the hoof wall as they load and unload the foot. It wants to be applied by a veterinarian or a farrier who's practiced with the product.
Right, Julie, well, I hope you're happy. I'm very pleased with what Richard's done. I think whilst she's still obviously got some way to go, I think she's moving better. She's keener to go forward and she's better on the turns, I think, and her ears are pricked and she looks happier on those feet. So, so I think that's all good movement in the right direction. And obviously that will start to address those changes that we've got there in the feet. In addition to obviously the medication that she's on for her Cushing's disease, which is likely the underlying cause of all this and certainly making a big contribution towards the development of the laminitis. So if we've dealt with the cause and if we can deal with those secondary changes, then hopefully she's right on track.
She's definitely brighter in herself than she was before she was on the medication, and she's definitely moving better now since Richard shooed her. So she looks happier all round, which is brilliant.
Yeah. Well, let's get that blood in a few weeks' time just to check she is still on the right dose, and we'll go forward from there. But
great.
Hopefully we're getting sorted.
Thank you.
Now, come on, David. Are all your patients that well behaved? When Richard was putting the drill into the horse's foot, I did think that horse deserves a medal. Richard
knows exactly where to put his drill on the horse's foot. And with a hay net in front of her, Echo is always that good. And most of them are, to be honest. Not always quite as quiet as Echo, but generally speaking, they're pretty good. And how's she doing now? Because that was several weeks ago that we filmed that. So yeah, she's all right. Yeah, she's just been re-shod. Richard's just had another look at her. She's a lot more comfortable. Hormone levels are good. They're back to normal. She's not back in work. We don't want her back in work yet, but so far, so good. So far, so good. And a big thank you to Richard and Julie and Echo for giving up your time to be filmed for the programme. Now, Teresa, we have seen Echo be tested for Cushing's disease. She's now on treatment. She has had her feet sorted out by Richard. So now we need to know what should we be feeding these cases, because it's so important. And I think there's a lot of conflicting information out there for horse owners. And I think maybe as an expert, if you could guide us through, that would be fantastic.
Well, certainly, as you know, patients with Cushing's disease do have specific needs, but nutrition is never black and white, and because there's always shades of grey, I'd like to discuss the underlying principles for the nutritional support, or behind the nutritional support, I should say, for metabolic laminitis, rather than look at a single case. For tonight, I want to divide the horses into 2 groups. Those with the typical PPID signs with muscle and weight loss, and on the other end of the spectrum, the comfortably cuddly horse with equine metabolic syndrome, with the big crests and the ribs that you can't really see. However, many of these horses will fall between 2 groups in terms of fat cover. So before we can decide on nutrition support we'd like to give your horses, we'd like to spend a few minutes going through a video to remind us how to fat score.
Regardless of whether your horse has Cushing's or not, as nutritionalists, one of the most important things we have to do is work out your horse's requirements. We do that based on body weight, workload, and then we have to work out whether your horse needs more or less calories by doing some fat scoring. And research has shown us that as owners, we're a bit guilty of not recognising fatness in our horses. So we felt it was very important to be able to share with you the technique that we use to assess fatness in your horse. We are going to show you today what we call the modified 0 to 5 scoring technique, and we've modified it because of the way that our horses are changing their body shape. And what we're finding, just like ourselves, is that different horses put on fat in different places. And it's very important that as owners, even if you can see your horse's ribs, you need to be able to identify if they're fat because, for instance, they've got a big crest. So what we do is we divide your horse into 3 different areas, and we're going to score the neck, the middle, and the bottom separately, and we're not going to add those up. We're going to give each one a score out of 0 to 5. So what we're going to do to begin with is start with the neck. And what we're doing with the neck is we're literally feeling for fat over the skeleton. And the first place I'm going to look at on this pony, who's called Murphy, he's 23, is we're going to feel for fat on what a lot of people call the top line. And what we're going to do to begin with is find his nuchal ligament, and you can find that on yourselves. If you bend your head forwards, you'll feel like a bunch of elastic bands down the back of your neck. That's what we're feeling for on your horses. So if you just get your fingers in here and squeeze, you can just see me massaging it down there. And basically there's no fat above that at all. And that's what we want. We don't want any fat above that nuchal ligament. So to be an ideal 3 or fat score on his neck, on your horse's neck, you do not want any fat above that nuchal ligament. Then the second place we go to is we run our hands down your pony's neck to his shoulder blade. And I want my hand to stop there. I want to be able to feel that bone really easily. I want to be able to feel the outline of that skeleton. And actually, although he looks quite slim, you can see here he's actually got a little bit of fat behind his shoulder blade. But he has a nice outline of his shoulder and he has no fat above his nuchal ligament. So on his neck, he's an ideal 3. So now we're going to move down to the second section that we're going to score, which we call the middle, which is everything forward of the shoulder blade up to the end of the ribs. And remember what I said is that we're feeling for fat over the skeleton. So we're going to feel for his rib cage. And you can see here, which is probably something not a lot of us see, you can both see and feel the ribs. And you can see my fingers going in and out of those ribs. Now, if you can both see and feel the skeleton, then that drops the horse down to a fat score of 2. So that suggests that we may well have a fat score of 2 here, but we have to do that in conjunction with their backbone. And so that you go back to the same place every time, what you want to do is put your hand on the lowest point of the wither, and you take your other hand, so you're going a hand's width from the wither. Lay your hand flat like this and let it relax. And if you bring it across, you can see I've almost got a triangle shape to my hand. So in other words, we can both see and feel those bones along his back. So again, that suggests that he's a 2. We'll see later what a 3 will look like. And for his bottom, you feel for fat over his hip bones, top of his pelvis, and his tailbone. So as you can see again, we can both feel and see his hip bone. We can both feel and see the top of his pelvis, and you can both feel and see his tailbone. So that means he's a fat score of 2 on his bottom. So if we put that into context, he's a fat score of 3 on his neck, which is ideal. He's a 2 on his middle and a 2 on his bottom, which means he's slightly lean. And actually, this is not unusual type of fat loss that we might see in a cushingoid pony. So we'll need to think about his diet in due course for this pony. So having met a slim OAP, I'd now like to introduce you to Annabelle, who's a slightly chubbier version. She's in her 20s too, but the opposite extreme, which is equally as dangerous and equally as likely in Cushing's. The difference here is that she hasn't got the abnormal fat distribution that you will see in Cushing's. But if I go through the fat score, you'll appreciate the difference between the two. So again, we're going to find the nuchal ligament, which is there, and you'll know you've got it on the pony because when there is a nuchal ligament that's inflamed with fat, that's the reaction you usually get. So it feels like the elastic band. You're following it down the neck, and at this stage, the crest is getting sufficiently thick. I can't follow it all the way down, so I'll show you with my fingers where it is. And that's one big crest, sorry, pony, that we've got here. And when you've got a crest that big, it's a 4 to start with straight away. But what we're also seeing here is some corrugation and some bulging out here, which would indicate that perhaps we're a fat score 5. But we need to do that in context with the shoulder blade. So again, run your hand down the neck to her shoulder blade. And actually, quite surprisingly, you can get your hand in there. You can see the outline of the shoulder blade, but we have got some serious insulation or fat cover around the back here. So on her neck, she's a 4.5. We're then going to move, as we did with the other pony, down to the middle. And unlike the pony, I can neither see nor feel the skeleton. In fact, you'd be hard pushed to know there were any ribs in there at all. So that is most definitely a 4. And then just with the other pony, I'm going to put my hand at the lowest point of the withers. And even here, the skeleton's starting to disappear a little bit. And then I'm putting my hand flat on the backbone. And that is just such a superb flat back. I'm not saying superb in terms of health, I hasten to add, but it's a nice example of the fact that, I bring my hand off, it's like that. There's insulation either side. I can neither feel nor see that backbone at all. The skeleton has been completely covered with fat. So that's a 4. But it's because of these little fat pockets that we're getting everywhere, that adds in another half score. So she's a 4.5 on her middle. So we're now going to move on to her bottom, and unlike that other pony, I can't feel her hip bone. You obviously can't see it. I can't feel the top of her pelvis, and you can't see it. And I can't feel or see her tailbone. So that puts her straight away into being fat, a fat score of 4 out of 5. But we've also got some unusual cellulitic lumps coming along here as well, which isn't very good. So in summary, this pony's fat. She's not just a cute native pony and cuddly, which is something we're perhaps guilty of thinking. She's at serious health risk of developing equimetabolic, of becoming cushingoid. And I think one thing to be really aware of is that the researchers at Liverpool University have shown that, for argument's sake, if this pony's 100 kilos overweight, I can manually palpate, or grope is the word I prefer, fat, about 50 kilos of that fat on her outside, but the other 50 kilos is inside, killing her from the inside out. So finally, this is Saunders. She's also in her 20s, and we're just going to do a quick fat score on her as well. So first of all, find the nuchal ligament, which is just here, and you see, unlike the pony that was very fat, we're not getting that pull-away reaction because it's not so inflamed, and there's no fat above that. And I think it is worth reminding ourselves that there is no muscle above that nuchal ligament, so if you have got anything above there, it's not top line, it's fat line, but fortunately we don't have that on this pony. And then I'm going to run my hand down her neck again, as we did with the others. And look at that, that's fantastic. That's what I want to see. A nice differential between her neck, and I know there's a bone there because I can feel it along the top. You can follow the outline. But having just done that, you can see we've got a tiny little bit of increased fat cover there. So although she hasn't got very much fat above here, and she's got the perfect outline around her shoulder blade, we might have to think she's pushing up to 3.5, but I think, to be fair to her, we can find all these bones quite easily. I think I'm quite comfortable by giving her a 3 on her neck. Then we move along to her ribs, and this is great. Can you just faintly see the outline of those ribs? And I can feel them quite easily. It's like moving a hand along a velvet curtain with stair banisters underneath. Ba-dum, ba-dum, ba-dum. That's what you should be able to do with all your ponies. So I can feel, but only just see the skeleton there. And then on the top to her backbone again, remember lowest point of the withers, hands width away, I put my hand down, and you see how I'm getting a nice curve there. That's superb. We haven't got that build-up of fat either side. Again, I can feel but not see her skeleton. So she's actually a perfect 3 on her middle. That's what we really want every pony to look like, regardless of their age. And then moving along to the bottom, you see I can just feel the outline of the hip. I can't quite cup it round there quite as much as I'd like to, but I can definitely tell there's some skeleton there. Top of her pelvis, you can feel the bones, but there's just a little bit of fat there that I can palpate. And then down onto her tailbone, which again, a little bit of fat, but nothing too serious, but just enough to put her bottom into a 3.5. So she's a 3, 3, 3.5, and that's ideal. So if we just summarise what we've just gone through, if you remember the little black pony, we could both feel and see his skeleton, so he was too thin. We then moved to the grey pony that we couldn't feel the skeleton and we couldn't see the skeleton. That pony was much too fat. And then finally we ended up with this little number where I can both feel but not see the skeleton. That's the ideal fat score. That's what we're after. And I think if you keep those 3 examples in mind, hopefully it means that when you go home and do your own horses, you'll find the fat scoring system quite simple to follow and quite simple to do. And just on the last note, what we'd like to suggest you do is if you do that fat scoring on a fortnightly basis and write it down.
So having sorted out how much fat cover your horse has and given the appropriate fat score, we're now going to start by looking at nutritional support for PPID. And I think you should think of the nutritional support for PPID as you would any serious medical condition. So if you take cancer, for example, cancer will not be cured by diet and it won't be triggered by diet. But if you support the cancer patient appropriately, then that works very well in conjunction with treatment. So the first thing I want to speak about is antioxidants followed by calories, followed by how we can minimise the effect of insulin, and then look at quality protein to minimise the muscle breakdown. We know from research that horses with PPID are compromised in terms of their immune system. So we want to support that immune system, and we do that with antioxidants. And we know that vitamin E is very helpful in the PPID affected horse. And one of the things we're well aware of is that plant-based antioxidants actually have a greater capacity to support the immune system compared to, for instance, vitamin E. But the problem is many of you restrict your PPID horses in terms of the amount of grass they have because you're worried about the insulin response to grass sugar. And grass is naturally high in that vitamin E and of course the other plant antioxidants, whereas the hay that you might replace the grass with is actually quite low. There is a simple solution. What we suggest you do is supplement with antioxidants or use a specialised feed with increased levels of antioxidants to support that immune system. The second thing we need to look at is the weight loss that you often associate with PPID. And we have to remember that fibre will not provide enough quality protein or calories for the PPID horses that are showing muscle and weight loss. These horses don't need nutritional restriction, or they need nutritional support. And this graph here shows, if you see the top line there in red, that shows the calorie requirement for a horse that's on in light work, that's on a high forage diet. And you can see that that diet's only providing about 77% of the calorie requirement. And we do know that a PPID horse that's got weight loss will have an energy requirement of nearly 20% more than a horse at maintenance that's healthy. So you need to feed calories to put the weight back on your horses and to support them through their treatment. And what we want to try and do is provide those calories in such a way that they have a similar response to your horse's blood sugar, or your horse's blood sugar, I should say, has a similar response as if it was on hay. So if you look at this graph here, along the bottom is the time of feeding, and up on the left-hand side is your horse's blood glucose. And you can see that a horse on ad lib hay, his blood glucose doesn't really change from the resting level, and that's our aim when we want to give your horse extra calories. So if you look at this graph here, it's a similar type of graph. We've got time of feeding along the bottom and blood glucose up on the left-hand side. And if I want to put calories into a horse, well, why don't I give them 4 kilos or nearly 5 kilos of oats, which is the red line that you see there. If we do that, we shoot up your horse's blood glucose, and we don't want that, obviously. And if you go back to near the bottom, and you'll see the green line there, well, that's your horse's blood glucose response to ad lib hay. So if I divide those high calorie feeds into small meals, so I meal manage, so for instance give half a kilo of oats, then that's the pink line that you can barely distinguish between that and the hay. So you can see it is possible to provide your horse with calories, and those calories don't need to affect your horse's blood glucose any more than hay does. And the reason we want to control your blood glucose, or your horse's blood glucose, is because we don't want spikes in insulin, as we've heard earlier. And what we have to remember is that starch, sugar and oil are all high in calories, and insulin resistance, as David mentioned earlier, or insulin, isn't just associated with starch intake. So some researchers in Germany looked at the impact of feeding a high-fat diet versus a high-carbohydrate diet on Shetland ponies' blood glucose. So again, we're looking at a similar thing here, except we've got one of the slides is showing your horse's blood glucose and the other one's showing the insulin. One of the diets is shown by the dark black even dots, and the other diet is shown by the clear dots. Now, which diet do you think is which? Interestingly enough, it's the high-fat diet that produces higher blood glucose, and in response to that higher blood glucose, you're getting a higher insulin response as well. But don't panic, we can help you feed to reduce the weight loss or improve muscle and condition, but keep the blood glucose close to resting levels. And the way we do that, as we mentioned earlier, is simply meal management. So if you take a feed and divide it into 2 meals a day, then you're really going to be very close to that red line that we saw earlier. You're really going to muck up your horse's blood glucose. But if you manage those meals so that you're feeding small amounts of glucose in each meal, so maybe 6 meals a day, then you can manage the glucose in the bloodstream, so it's very similar to hay, and you're not going to get an insulin response as a result. And then the other issue we need to address, of course, is muscle loss. And we can do that by improving the protein quality that your horse has to eat. And if you look at this research that some people did, they basically took 2 groups of old horses, and one group they supplemented with amino acids and the other group wasn't. They were both on a normal diet, and what they found was that there were no changes in body weight, but the horses that had the extra quality protein lost fat and gained muscle. But we do need to emphasise here that obviously you need to be exercising your horses in order to build that muscle, as well as doing the supplementation at the same time. So in summary, for PPID, we're looking to increase the nutrients in your horse's diet, particularly the antioxidants. We want to feed them additional amino acids to minimise muscle loss, and we want to meal manage. We meal manage so that you can feed calories to get that weight gain, but we want to control those insulin spikes. So now we move to the other end of the spectrum and look at nutritional support for equine metabolic syndrome. And the key here is calorie control, because calorie control is the only way you can reduce fat, because research shows that if we can lose fat off our horses, we can reduce insulin resistance, we can reduce chronic inflammation, and that's the best way to reduce the risk of laminitis. So before we think about how we can control calories, I just wanted to share a slide with you to show you what is making your horses fat. And I think some of you are aware of this already. If you look at the bar chart there, basically the fat horses, i.e. those with fat score over 3.5, are those in purple. And you can see that 85% of you with overweight horses are feeding less than a scoop of feed. And that's what you tell me. I'm not feeding them anything. But you have to remember that grass is the main source of calories for your horses. So please don't tell me that your horses get fat on fresh air. This little pony here is not getting fat on fresh air. He's eating 104 heap scoops of fresh grass every day. So the only way we're going to be able to control that intake is to look at 3 ways of doing it. We want to control calories, we want to maintain bulk, and we want to provide optimal nutrition. First thing I think we've got to remember is energy and calories are exactly the same thing. So I'm really sorry, but I cannot feed this gentleman any more calories to make him run faster and win the marathon. And we can't do that with this horse either. He doesn't need any more energy, this laid-back cob. He's got enough of it on his back as calories. So just remember that word energy, use calories instead. And as we've said, grass provides excess calories to most of our horses, and we know that it can provide nearly twice the amount of calories your horses need for light work. So we need to restrict those calories. And if you see this graph here, if we restrict grazing, the red bar shows that we can reduce their calorie intake down to about 80% of what they need. So you'll start to see weight loss. But restriction might not always be necessary. As you know, as owners, it depends upon the season and grass quality as well as the quantity. So if you see here, the yellow bars on the spring and summer grazing shows that our horses are getting way over excess calories. But in the winter, they won't be getting enough calories. And in the autumn, they might be just about getting enough to maintain their body condition. But we're aiming to lose some of that fat. So the second thing we want to do is to make sure that we maintain bulk, or what I would describe, or some people might describe as dry matter intake. And why do we want to do that? Because reducing bulk is a welfare issue. You know, if you cut back on fibre too much, your horses are increased risk of stereotypy, of colic, of gastric ulcers and dental problems. And the literature supports that. There are lots of research papers that show us that restricting forage is bad for our horses. And one study has shown that when you do restrict little ponies, about 250 kilo ponies, down to 1.5% of body weight, they will eat up to about 3 kilos of wood shavings a day. You'd be really cross with me if we did that. So restricting bulk doesn't always mean that you will lose weight off your horses unless you take the calories of that bulk or that dry matter intake into account. So if you look at this slide here, on the left-hand side, we've got some alternative different forages, and you'll see the second column in, they're all being fed at the same weight because that's 1.5% of a 500 kilo horse's body weight. But if you take barley straw, for instance, we're not talking wheat straw here, then you'll see the calorie intake from 1.5% body weight is 59% of the horse's requirements. Your horse will lose weight on that. But if you decide to feed high fibre haylage, then your horses are going to be getting nearly 200% of their calorie requirements. And that's why you might not find your horses are losing weight in the way that you might expect them to. So maintain bulk, but reduce calories. And so how can we do that? Well, obviously, as we said, restricted grazing is important to control the calories from grass. So the question you would say to me is, well, how much should I restrict it? And to put it crudely, I'd say you should poo pick, because your horses will produce between 1 to 3% of their body weight as droppings a day. And if they normally, for instance, produce 20 droppings, you restrict the grazing, it goes down to 1, then we've obviously got it very wrong. But if they're doing about 1% of their body weight as droppings, then just remember, if they're eating, or rather I should say if they're pooing, they're obviously eating, and they're eating enough. The other way of just monitoring is to take a supermarket carrier bag into the field with you with a pair of scissors and cut the grass that your horse is eating. Now, if it takes you about half an hour to fill that bag, too much grass. But if, as it does with us when we're doing grass intake studies, it takes about 2 hours, then you've probably got it about right. And that's what we do at World Horse Welfare. We restrict the calories from grass, and we're able to maintain their laminitic prone ponies out 24 hours a day, 7 days a week. So the solution here is that restriction of grazing means that your horses are getting that occupational therapy, they're getting their bulk, they're getting their calories restricted, but they will be deficient in some of their vitamins and minerals. So it's very important that you make sure they get the nourishment they need, and the sort of products that you want to look at in this situation are, for instance, balancers or a general vitamin mineral supplement. You're not wanting to add calories back into the diet, but you are having to nourish those horses and ponies. However, what happens if you're in a livery yard where you don't have access to a starvation paddock and you need to bring your horses in? Well, in this situation, we need to look at restricting calories from the forage. And the best way to do that is to soak hay for 12 hours, and then you can feed the bulk that's required. And a study at Nottingham University that was published showed that horses fed soaked hay had lower fat scores compared to those horses that weren't fed soaked hay. But do remember that when you're soaking hay, yes, you're losing calories, but you're also losing nutrients such as minerals out of the hay into the water. So be very careful that you're not overfeeding your horses, but undernourishing them. We do need to put the vitamins and minerals back into these horses' diets. So balance in vitamins and minerals is crucial for the equine metabolic syndrome horse, and we need to do that when you're restricting the grazing, if you're soaking the hay, because we don't want these horses undernourished. There's good evidence in human obesity studies that an imbalance in micronutrients is very strongly associated with risk and existence of obesity. And finally, I should just say that, slightly tongue-in-cheek, but stabled horses are like us being in bed. You can't lose weight in bed. Stabled horses lose fitness. But if they are able to go out, they will remain as fit as an exercised horse. So I know a lot of you don't like muzzles, but honestly, it's a much better way of dealing with this situation. The horses are moving around. And if you don't want to muzzle and you still have a lot of grass and we feel it's not appropriate to keep your horses in, then why don't you get out with a lawnmower, with a picker-upper behind it and cut the grass? If it's not there, they can't eat it. And then just very finally, just with ourselves, nutritional support will not work on its own. It has to be done in conjunction with exercise. And so what we want to promise our horses with equine metabolic syndrome is that every day we're going to walk them briskly for half an hour so that we get their heart rate up to 80 beats a minute. And we want to make sure we do that because exercise is protective against insulin resistance even before your horses start to lose their fat cover. So, in summary, always take nutrition into account, balance vitamins and minerals, control their calories but maintain that bulk, do fat score and weigh take fortnightly and write it down. Remember that exercise is vital for longevity and forage should always be the foundation of that nutritional support. We want to get rid of that fat, and the best way we can do that is to help each other.
Thank you. you so much, Teresa. That was absolutely great, and I can tell you we've got quite a few nutritional questions coming in, so we'll be coming back to you soon. And I do hope that you'll all take that fat scoring advice from Teresa and go home and take a real critical look at your horses and act accordingly. So I hope that you've all enjoyed the presentations that we've put on for you this evening. We have had hundreds of questions coming in from the viewers tonight, and I'm really sorry obviously that we're not going to have a chance to go through all of them, but we've picked a bit of a cross section, so hopefully trying to cover most of the areas that you're interested in, and I'm going to put these to the panel now. First of all, I think a difficult situation when we're talking about the fat scoring, which I'm actually going to put to Jo, was what if you've got a horse that's really thin so you can see its ribs, but they still seem to have fat pads on their necks, and do they still have to keep dieting that horse?
I think that has to be based on the individual horse or pony, and I think if you're getting to the point they've lost a significant amount of weight, you have to be congratulated in that you've made some progress diet-wise, and you will have undoubtedly improved their insulin sensitivity. The difficulty is that often the abnormal fat deposits, and particularly the cresty neck, are the last things to go and may never in fact disappear. But as David had alluded to earlier, fat isn't an inert substance. It's active in terms of the chemicals that it's producing, and also there's a certain proportion of the fat inside that we can't see. So outside we can appreciate that we've had a significant loss of fat and weight loss with that successful diet, but there may be a little bit more in the way inside that we can't see. So there's this new thinking in terms of human medicine of being fat on the outside and thin on the inside, or vice versa. So they may appear thin, but they may still have internal organ function that's operating as if they were still overweight. So I think probably the most appropriate thing to do is actually consult your vet and speak to them about actually checking their hormone levels, so you can see exactly what their status is inside. You've obviously done well in terms of reducing their weight outside, and I think perhaps checking their hormone levels so we can look at their disease status and perhaps their laminitis risk is the most appropriate way in terms of developing then a tailored diet plan going forward. And that would be the point once you have those blood results back, to then speak to somebody like Teresa, who's a nutritionist, that would be able to make a tailor-made dietary programme for your horse or pony.
Perfect. Thank you, Jo. And talking of dietary programmes, we've had a few people panicking that they've got to feed their horses 6 times a day to keep their insulin levels down and reduce the risk of laminitis. So is there more of a happy medium that you could suggest, Teresa, for for balancing out meal portions?
Yeah. I think it's important that you talk to the nutritionists of the products that you use, because they will all vary in their starch, in their sugar and their fat content. And the key is to feed them in small enough meals that we're not going to trigger that insulin spike, because it is dangerous, that insulin spike, and it is vital. And I think we do have to take a bit of responsibility. I know practically with us all working, you probably can't do 6 times a day, but the calculations need to be done, and then we need to see how small a meals we can do and how frequently. And that's where I would work in conjunction with the veterinary surgeon. And we may in that situation take a few more tests than we might do normally, so that we can come to a compromise that you can manage that doesn't adversely affect the health of your horse.
And Teresa, we're talking about different types of forage. For a pony with PPID, is hay or haylage better, and if so, why?
Oh, that's another one of these shades of grey questions, really, because it would depend on the fat cover of your pony. So if, for argument's sake, we take the typical PPID where they've lost weight and you're trying to put calories back on, then haylage would be good. As you saw from that example, it can give nearly twice the calorie requirements that your horse needs. And some people worry, isn't haylage, if it's high in calories, high in sugar? Well, no, because haylage is preserved forage that's fermented, and what the bacteria do is ferment the sugar to preserve that forage, so it would be low in those sugar spikes. If, on the other hand, you've got one of these horses that have put the weight back on because their medical treatment's working really well, and you've got to the stage now where you need to control calories, then of course hay would be a better option, because you can soak hay, so you can halve the calorie intake and keep the bulk up. So I hope that makes it a little clearer.
I'm sure it did. I'm sure it did, Teresa. Thank you. Liz Crossley has sent in a couple of epidemiological questions. So guess what, Jo? We're coming to you. She wants to know, is PPID increasing amongst young horses, or is it just that the tests are better? Which is a fairly reasonable question. And also, is PPID a natural part of ageing in horses? So will all horses get PPID eventually?
Very interesting questions. I'll go for the first one first. So in terms of PPID increasing in younger horses, I think, as Liz has sort of astutely observed, a lot of research has gone into improving our diagnostic tests for PPID over about the last 10, 15 years. So undoubtedly our ability to diagnose the disease accurately has improved, but also both owners and vets are better at picking up on early signs. So I think we're detecting the disease earlier. So I don't think so much that it's increasing in terms of its prevalence. I think we're just better in terms of assessing the early cases and subsequently then having much more accurate tests to diagnose them. With regards to it being a normal part of ageing, then I think it's difficult to say that any disease or disorders is entirely a normal part of ageing, but certainly obviously we know that the risk definitely increases and that it's a slowly progressive disease. So while it's not an inevitability that every older horse or pony will go on to get it, we certainly know that as they get older, that risk definitely does increase.
Thank you for that. And talking of testing, Lorna Muirhead has an older pony with the classic signs of PPID. So she's noticed that she hasn't shed her coat and she's got a bit of a pot belly. Yeah. She's had previous history of laminitis, and so she tested for ACTH earlier this year in January, I think, and the blood test came back normal. So she's worried that she wants to prevent future attacks of laminitis. What should she do now? Is it worth testing again?
Yeah, it is worth testing again. It would be interesting to know how normal is. There is a grey zone, and it maybe it's in that zone. So as we showed in the graph earlier on, now is a good time to test. There's a bigger disparity between normal and abnormal horses. So definitely, think about testing again now. There are follow-up tests we can do as well as the ACTH, which we didn't have time to get into tonight. And they're not that often applicable because ACTH is such a good test. But for those horses that were a bit iffy earlier in the year, this time of year is an ideal time to follow them up.
Perfect. And talking of seasonality and then horses going on to treatment, we've had a few people here who are wondering, can you just treat them for some of the year, maybe when they're more susceptible, or do you have to treat them all year round? And what's the best advice on that?
The condition doesn't go away. It's a degenerative disease that does not reverse. We just have to manage it. So they need to be kept on treatment where at all possible. It may be that they can manage with lower doses out of the autumn period. So when we get into December and then back through to July next year, they might be able to cope on lower doses. But I would really strongly advise people not to stop the treatment because they're just exposing their horses to risk again.
Increasing the risk again. Yeah. And in terms of, you did mention monitoring in your talk, but some people are unsure how often should the percent levels be monitored by blood tests?
You need to work in conjunction with your vets on that, but what we would suggest would be to get them stable, get them at the level you want them at. So that would probably be monthly testing, maybe once, maybe twice, maybe 3 times if you're unlucky and it takes a while to get the dose right, and thereafter ideally twice a year, once in the springtime, once in the autumn time, to make sure things stay under control during the autumn. And then you might be able to get down to annual testing once you've got a feel for what your horse is doing, but you do have to tailor it to the individual. So don't just take my word for it, speak to your vets.
Case by case basis. Yeah. And we have had quite a lot of really specific questions on people's horses. They're worried about possible laminitis, possible Cushing's disease. So please go and talk to your own veterinary surgeon about these cases if we haven't been able to get to your question. We have another treatment question, so I'm going to put this to Dave. There's a few questions actually have come in from a few different people. Have any studies been carried out looking at herbal remedies for treating PPID as an alternative to prescription medication?
Vitex agnus castus or chasteberry extract is the herbal remedy that most people are familiar with Cushing's disease. There's one independent study that's been performed. It was performed by Jill Beach back in 2002 at the University of Pennsylvania. So it was an independent study, and they had 14 horses, and virtually all of them got considerably worse when they were treated with chasteberry extract. Their hormone levels got worse, and the study was aborted in a lot of the cases. So not good really. And a number of those horses then went on to Perglide and did improve. So that would fit with the experience that I've had and my colleagues have had through our laboratory when we see horses that come through having been treated with chasteberry extract, invariably their hormone levels have gone up. So it's disappointing really, because it generally speaking, it often costs the same amount as the licensed product, yet it doesn't do the same job. So yeah, there we go.
Very good, Dave. Thank you very much for that. And a final question, I think, this evening for Teresa, because we really are going to wrap things up now. And it's just a practical feeding suggestion. So from Vanessa Thomas, she says, do you have any suggestions for reducing calories in a pony who is only turned out for 2 hours per day and wears a muzzle when turned out? He also has a soaked hay net when he's in for the remaining 22 hours a day. So it does sound like this is a fresh air one. Teresa, what could you suggest?
I think it probably goes back to that almost final slide I had. If you stayed in bed for 22 hours a day, you're not going to lose weight. You're not using up the calories that you're having to eat to keep you alive. So I think the bottom line there is always exercise is as important, assuming your horse is sound, obviously, as the dietary support. And particularly with horses, they need that bulk intake. If you're soaking hay, then you're getting rid of some of the calories, but it may be worth actually analysing your hay to see how many calories were there in the first place. And you might need to dilute it with, for instance, oat or barley straw. But I think the most important thing probably in that situation is you've got to increase the calories that pony's using. And the best way to do that is daily exercise. I hope that answers the question. And also just check, you said you was on a balancer, so we're getting the vitamins and minerals, so that's fine.
I could certainly do with more exercise, Teresa, so that's good advice all round. And I think we're going to have to end it there. Thank you so much to our experts, David, Joe and Teresa, for sharing this fascinating information with us this evening. Thank you to the Liphook Equine Hospital and to Red Wings for being so hospitable, and to Julie, Echo and Richard the farrier. Remember that you can watch again on demand. We will post on Facebook and on the website when this is ready to be watched, and we would love to get your feedback. So if you can just take a few minutes to fill in the feedback form that will appear on your screen in a moment, it will be much appreciated, because it will help us when we're looking at content for future presentations, which is for everyone's benefit really. So you can comment on Facebook as well. I think you've seen the messages coming up on the screen, and just from all of us here, thank you so much for watching and good night.